Welcome to Health Live at Seniors Today. We are delighted to have here with us once again Dr. Roop Gursahani. Dr. Roop Gursahani is one of India's top neurologists. He's a consultant neurologist and an epileptologist at the PD Hinduja National Hospital in Mahim and the Hinduja Healthcare Surgical in Khar in Mumbai. He's trained at GMC Nagpur and the Grand Medical College and Sir J.J. Hospitals in Mumbai. Welcome once again to Health Live at Seniors Today, Dr. Gursahani.
Thank you, Mr. Maheshwari. Thank you, Seniors Today, for having me again. And as always, it's a pleasure to interact with your very, very engaging and interactive and intelligent audience.
Thank you. We had some rave reviews for your session last time, which was where we also had Dr. Raja Mayer, and we were talking about palliative care. The topic for today, as we've announced and we consulted with you, is dementia and other neurological concerns for senior citizens. But before, as I invariably always do, in the last 1 year that we've had these webinars, in fact, we've completed 1 year of the webinar. We started out in June last week, and we've been at it every week, but saved that 1 week for Diwali when we took a break. Dr. Gursahani, from your point of view?
There have been personal tragedies. I mean, fortunately for me, there have been not minor, but few. Not even one is minor, but they've been relatively few. I mean, you read about what is happening to people, you follow it on Twitter, and it's not easy to for us not to accept that we've all gone through a huge collective trauma. And I'm sorry to put it that way, but I would want to see justice done once this is over.
Absolutely. I think it has been traumatic for all of us. But from a medical point of view, how do you see the situation now? Is it?
Yeah. So as of now, the wards have. I'm not on the front line there. I don't treat COVID patients directly. So, but from what I know from my colleagues there, the wards are about half empty now. So the second wave, the peak of the second wave is well behind us in Mumbai. But as we've learned, I guess the BMC is being pretty careful, and as the lockdown is being eased, they are keeping facilities running. And I mean, everyone needs to be masked outside. I routinely interact with patients, and they walk into my clinic, they say, hello. I blow my tongue. I mean, politely, but if somebody says, but how will I talk to you? I say, no, I don't want to hear you except through a mask. If you talk to me without a mask, you are gifting me viruses if you have any, straight across.
Right. Just before we move to the topic, is there, a general word of advice that you would like to give to people who are,
Mask. Vaccinate, mask. Only two. Vaccine and mask. There is really nothing else.
I guess those two words are critical. We have one of our attendees, Dimple Davesha. Can we get to the topic? Yes, of course, we'll get to the topic. So, Dr. Gursahani, we have, as you very rightly mentioned, we have people who are exceedingly engaged and who want to get to business immediately. So we will do that. Some opening remarks, Doctor, from your point of view in terms of the way, the various neurological concerns have built over the years, if at all, and what are the guiding principles for keeping good health in neurological terms. And those of you who have questions, please put them in the Q&A tab. We will attend to them. I know there are some questions on the on the chat window. We'll take them too. Over to you, Doctor.
Okay, I think as far as the brain is concerned, it's like, it's use it or lose it. So you have to stay engaged with the world around. You have to stay active. And I think we'll discuss that as we get along, because I'm sure they'll come up as the questions come up. And one thing we all have to remember is that we are yet not a fully aging society. I think if anybody of you has noticed, China has given up its 1 and 2 child policy. Yeah, I'm not recommending that we have multiple children, but we are also going to be aging soon. And we have, yes, your audience knows that. So let's.
Yeah, so I will get to the questions right away. And there's one from Mr. Jinendra Jain, who says, I had a stroke in Jan 2019 and December 2020. I'm able to walk and do my activities almost normally, but I have tingling in my hands and the sense is reducing. Can you please suggest a treatment and medicine?
No, that I think is something that you will need to connect with your neurologist to address your symptoms, to make sure that your investigations are complete, that your medications are complete, properly adjusted. And beyond that, I think it is important for you to be active. So if you've recovered fairly well, I think the important message for you is to stay active and to enjoy life. And for more details, it's best if it's done by a doctor. This is not something that can be done on this program.
Right, absolutely. I don't think we're here to give overall guidances, but specifics is best that you consult a doctor. We have a question from Mr. Malcolm Montero, and it's a general question, but he says, how does one know that one has dementia, and can dementia be arrested and or reversed?
Yeah, I'll answer that and you'll give me a Nobel Prize after that.
Of course, you have the prize from all our senior citizens.
No. To be serious, I mean, what you asked is actually the fundamental question. So if you look at the first part of it, knowing that somebody is getting dementia. Now, when dementia actually begins, in the sense that there is memory loss and so on, is something that anybody who's afflicted will probably recognize. Though, of course, there are individuals where it affects judgment, and they may be less aware of it than people around them are. But you will be surprised to know that whenever this has been studied in detail, and now there's enough evidence that anybody who has dementia now actually had the whole process pathologically in their brains begin 20 years before. 20 years before, or a little more, as far as we can make out. And that means that somebody who has dementia at the age of 70, well, the changes had begun at the age of 50. So, as I speak today, I'm 62. Yeah, if I'm headed there, it's probably started. So we all live with that. Sorry, what was the second question?
What is it that one can do to prevent it from happening?
Now that is a... choose your parents wisely.
No, but is there some dietary, things that one...
I will expand a little bit on this. Choose your parents wisely. I mean, it's actually been said seriously, because finally, there is a certain genetic endowment that we all carry, right?
Right.
And what we carry is not as simple as, of course, basic things like did one's parents live till the mid or late 80s and not have any signs of memory problems and so on. That is important. But there are lots of other pointers that can come up in both in when we kind of inquire in detail, as well as in certain genetic tests. And we usually don't recommend those tests because, as of now, pointing that out without having the means to correct it is, well, not really correct. So what we suggest is that if there is any history of dementia in the family, then you need to be particularly careful. And we'll be discussing what measures you can take a little further along. But for instance, my father had dementia, and he passed away at the age of 86. And yes, that's something that deep down is a bit of a worry for me. Okay, can we take on the next question?
So if one's parents or immediate family, no one has had dementia, can one say that you are in a safe zone?
If you have not had, if nobody has had.
If my parents have not had dementia, can I say that I'm in a safe zone?
No, you can't. You can't, because this is one of those things that has, one of those issues that has a host of influences building over a long period of time. So there are various things that we do recommend people to do, but it's not as though there is one single treatment or one single thing that you do and you'll be safe and you'll be out of it. No.
Right. We have a couple of more questions which are basic in nature. One is from Baljit Singh. What can be done for someone going through age-related dementia? What kind of care is recommended?
Okay. So age-related or dementia in general is not much different. I think the care that you need to take of that individual will vary according to the stage of the dementia. At the very early stages, the basic care that you do take is to see that all the factors that are likely to worsen it are corrected. And typically, very simply, we take care of what we term vascular risk factors. Has that ever been discussed on your show? Vascular risk factors?
I don't think so.
Yeah. So basically, you mean anything that deteriorates your heart arteries, brain arteries. So hypertension, diabetes, cholesterol, smoking, overweight, and for overweight, you look at the waist to hip ratio and abdominal obesity and so on, which Indians are particularly prone to. And alcohol use. These are factors that are amenable to correction. So these are factors that ideally should be tackled in that 20-year before period. But if not, at least once it starts off, you can start paying attention to them. Then there are some medications that people do use, which are supposed to slow down dementia, but there's some doubt about how effective they are. Probably not very much. Because if you take the medicine and don't do the rest of what I told you versus the other way around, I think the lifestyle improvement is far better. So that's the first stage. The second stage is when the individual starts to become dependent. And basically then, rather than medical treatments, the bigger issue for the family is that of keeping the person engaged, keeping the person safe and active as much as is possible. And as an individual starts to go down through dementia, they first lose the ability to carry out what we call instrumented activities of daily living. Now that's a rather long mouthful. basically it means activities of daily living is simple. All of us can understand that. So instrumented is when you use your environment. As humans, we are social animals. We use everything around us. So I get up in the morning, I get ready, I'm planning the day ahead. I know I plan the route to where I have to go to. I plan my activities, carry them out. So there's an occupation and so on. And if you look at anybody, all of us have to do things like maintain phone conversations, our connections with people. We have to take our medicines. We have to, if we go out of the house, we have to plan going out and moving around. We have to plan our personal finances. So when people are, when we do this systematically, I mean, when I'm talking of instrumented activities in daily living, you're looking at a huge list of things that people can do. But the four that I normally check out are these. So these are instrumented. So as that individual goes down, these start to shrink. So a person who had 800 Facebook friends and could tell you about all of them now has 100, 150 people who he can kind of in passing remember. And then over a period of time, he stops making calls. And then over a period of time, he just takes calls. And that's it. And because this happens so slowly, families don't realize it. So instrumented activities of daily living go down. And it's only towards the end of this that basic activities, meaning shaving, taking a bath, doing a basic toileting, those also start to decline. So depending on where that individual is along this trajectory, family members need to pay attention and see that the person is safe. Medications, yes, we do have a couple of medications that we use for this period, but these medications, again, are not terribly effective. They do have their own side effects. So there are times when I start the medication and then have to stop it and, we effectively don't have. So as you can understand, much of this is tender loving care. And then the person becomes completely dependent and goes down to the point where they need support for everything. Speech goes down and so on. And at that stage, the care that is required is very basic and actually becomes pretty intensive. So it's for somebody who takes care of somebody with dementia. I would say it's a big endeavor, and I really salute those people who manage to do it, and where both the patient and the family are smiling when I meet them. I can't believe how much that feels good when I see it.
I can imagine. We have a question from Milind Kulkarni, who says, my mother has dementia. She's 83 years old at home. We basically take care of her, but a few months back, she had a fall, which led to a surgery. She gets violent when she has a bath and cleans her, thereby hurting herself more. Any suggestions as to how one should handle?
This again gets into some rather specific issues. One of the problem is that if she's at the stage where she's not really very mobile, then you will need to assess. I mean, you or your doctor will need to assess pain, especially during movement and so on. So simple things that we do is just before you do something that is going to be really painful, you give a decent dose of Prosil, paracetamol, control the pain and then do it. Or the other way around, you figure out, are you giving her a bath for her or for yourself? I mean, I know everybody should have a bath twice a day, but there are people who stay fairly clean, and you have to figure out what is necessary. So that's so individual. That is so individual that you need common sense and perhaps at the maybe a little bit of medical knowledge to do it.
Right, thanks. We have a couple of questions which you've kind of answered, but I'll just, Devendra Kada says, how much of a role does genetics play in dementia, which you mentioned? Samuel asks, is it possible to take steps if I'm not diagnosed yet at 61? It is said that everyone after 65 has some form or degree of dementia. Would you agree? I want to ask another question, which is kind of similar, which is asked by Mr. K.V. Lakshmanaran. He says, it commonly happens to me to forget as to where I've kept things. Frantic search happens, and when found, I recall how it was kept there. How can this be attributed to when my memory is strong with respect to things that happened in the 60s and 70s?
Yeah, so we have, I use the analogy of a computer. You have a hard disk and you have a RAM memory. And as you get older, well, your RAM memory may be getting a little slower. It's probably getting, and it tends to discard stuff that it is not finding immediately useful. Whereas stuff that is tucked away in your hard drive, as soon as you access it, is there. And it's there. The full file is there. Right? So you have to remember that things that you are a little forgetful about, and the way to identify it in a family is, and this is not, I'm not joking, this is really so, we use it clinically also, is that do other people complain that you're forgetful? If you think you're forgetting things and everybody else thinks, there's nothing special about this, maybe you're worrying too much about it. So I always tell, in fact, today, this morning itself, I said, is your wife complaining about it? If she's not, then I'm not there. So forgetfulness of stuff like this, where did you do it and so on, is probably natural. It's also to do with concentration. It is also to do with the emotional salience of whatever it is. Some things, some people never forget. Some things are routinely forgotten. I think you have to put it into context.
We have a question from Dimple Devecha, who asks, I guess she's referring to dementia patients. These patients have a problem in chewing their medicine.
Sorry, I didn't get that.
Dementia patients have a problem in having their medicine. What should be done?
Chewing, no. So I am not sure what they're getting at. But what happens is, as dementia progresses, we call this, if you want, you can look this up, the stages of dementia. It's called the FAST staging, capital letters, FAST. And towards the later stages, control over the oral structures. So it's speech goes. So these are individuals who start speaking and simultaneously swallowing also starts to get affected. And they might have problems taking medication. So one of the things that we do at this stage is to look at their medication list and cut out stuff that is not necessary. I mean, you're looking at somebody who probably has a lifespan of over 1 or 2 years left, and you're giving a cholesterol medicine which is frankly meant for 20 years later. No sense. So we cut out all medicines that are unnecessary, come down to the basic, and very often you find that not much is really required. So if I were to look at this problem of, I would first go to checking out what medicines were required, and if they were essential, then figuring out how to get them in, given the condition of the patient at that time.
Thank you. Dimple Devecha has asked, has clarified. She says that they keep their medicine in the corner of their mouth.
Same thing. Same thing. So if it is an essential medicine, then you will have to, and if the person is already at the stage of not being able to take normal food, then you might need to crush it and mix it into something and give it.
Right. We have a question from an anonymous attendee. He says, "Hello, doctor. My mother is 64 years old and has had dementia for the past 3 years. She is now completely dependent for all her daily chores. Loss of speech is also now there. When we started medicine from a neuropsychiatrist 2 years back, to be continued."
Just give me a minute. Huh? I need to look at anything urgent because I'm doing a lecture. So then at 6:30 I'll be free. Kuch rahega to tab. Yeah. So
This is, I'll just repeat the question. This is from an anonymous attendee who asks, "Hello, doctor. My mother is 64 years old and has had dementia for the last 3 years. She's now completely dependent for all her daily tasks. Loss of speech is also now there. We started medicine from a neuropsychiatrist 2 years back. Are they to be continued for long, or do we need to stop?"
I'm sorry to hear about something like this, because dementia, when it starts off early, is so much more of a tragedy. And again, I really can't give specific medical advice on this program. So you really need to be in touch with a neurologist locally, figure out what are the medicines that are absolutely essential, and come down to the bare minimum that are needed. And typically we focus on controlling symptoms. So basically making sure that symptoms are, as for instance, say, you see that it's important to make sure that the person doesn't get badly constipated. Then if they are excessively agitated, provided there is no other obvious cause for it, then you might want to keep them on a medication to keep them calm. You might want medications to make sure that they sleep and wake at appropriate times. And then you may need medications for basic things like blood pressure and diabetes and so on. But that needs a doctor to sort that list out. I think and I'm going to state this here, that both, and this is not, because I'm a doctor, I know that we all need to get out of this culture of मैं दवाई नहीं खाऊंगा तो ठीक कैसे होगा, या सब चीज के लिए दवाई नहीं रहती है. And there are times when the best doctor is one who doesn't prescribe anything. So you need to figure out what is really necessary.
Right, absolutely. Doctor, it's not a question, but I'm just wondering, in this period of the second wave and the fear of the third wave, etc., visiting a doctor can be a bit of a pain, and there are people who are worried about it. Now, is it all right to be taking a teleconsultation for issues on like dementia, etc.?
See, that I think it's always a little tricky, and I run into this issue with my own patients. So if it's a patient that I've already seen, then I tell them myself, next time it'll be let's do a teleconsult. Don't bother coming. But seeing a patient for the first time, I am there are manuals of how to do a proper substantial examination online using video and so on. But my own feeling is that unless it is absolutely necessary, I would prefer to examine the patient myself at least once, right? Follow-ups, yes. Follow-ups can well be on teleconsult, and once a couple of or 2 or 3 encounters have gone past, both you and the patient, I and the patient, or the other way around, you know each other, and you know when it is necessary to go to the clinic and when not. And going to the clinic or the hospital, I think most decent hospitals now maintain fairly good protocols. I mean, if you look at people picking up COVID from the hospital, it doesn't happen. We've time and again we've seen that even amongst doctors, people who picked up COVID have picked it up because they've been careless outside. It's not that people pick it up within. And even in the hospital, if you and everybody else is sitting around without masks, I mean, what can anybody do about that? But if you're properly masked, maintain social distance. The hospital is, well, safe.
Right. And what are the kind of tests one should, so that one doesn't have to do a back and forth? Are there some kind of tests that one should get done in beforehand before coming and meeting a neurologist?
No, at least I know that internationally, say for instance, in many big centers, they have a prior questionnaire which they give and a list of tests that they want you to complete before. But for our purposes and given our costs and so on, I don't find that useful. I prefer to tailor it after the encounter, after you visited the, I mean, I think the doctor has to think it through and then prescribe tests.
Right. Thank you. We have a question from Mr. Malcolm Montero again. Can an MRI show deterioration of brain cells?
It doesn't show deterioration of brain cells, but there are 2 or 3 things that you can pick up on the MRI. The first are clots. So anybody whose brain is already showing clots because of blood pressure, diabetes, cholesterol, smoking, the combination, vascular risk factors, that's obviously a brain that is already taken a hit. And these clots, sometimes they can be pretty dramatic, and they may be so dramatic, and the person in front of you may visibly be normal. So that is marking out damage. The other thing is looking at specific structures in the brain, and that is not routinely done unless a doctor or a neurologist asks for it. There's a structure in the brain called the hippocampus, Hippocampus, hippocampus. Okay, so this is largely where your RAM is stored, RAM is located. And as you can imagine, in people who develop dementia of the Alzheimer's type, specifically of the Alzheimer's type, that tends to shrink, and that can be picked up in early MRIs. In fact, that's been used for identifying patients before they become, before they actually show signs of dementia, though that requires a fair amount of technical expertise, and we do not routinely do it. So these are 2 things. Then there's other stuff also, like accumulation of fluid in the brain and so on. And but the commonest and the finding that scares everybody is something called atrophy, ATROPHY, shrinkage of the brain. Now, radiologists often put that in the report. And frankly, that's something that is often commensurate with age, and we usually don't pay any attention to it, technically. So you need to not look at that, and these other things, yeah, you will need to discuss it with a neurologist.
Absolutely. Thank you. We have a question from Katie Dalanche, who says, Doctor, my husband, who's 76 years old, keeps forgetting where he keeps things, and that causes us anxiety. He sleeps only for 6 hours a day. Could his medication for mood swings and high blood pressure be the reason for this?
forgets where he keeps things. Yeah, so we've really been through that. And yeah, but forgetting more important stuff like forgetting your way around your neighborhood, or maybe even forgetting your way around the house, or forgetting um, or making mistakes while filling out a check, which is not something that. Those are things that I would watch out for. Forgetting stuff around the house is, I don't know. If it's part of a pattern that's been there for a long time, I would not bother too much about it.
Like
In fact, just ask you, why are you getting bothered about it? It's not something that bothered you earlier. So think about that as well.
But there's a more specific question which Yasmin Todiwala has asked. She says, I'm 71 and keep making mistakes calling others by other names. Is this part of dementia? How can one correct or prevent?
I never presume anybody's name. I always introduce myself because I don't presume that they're going to know my name if I have not met them frequently or whatever. And I think we all need to understand that face and name. Okay, just think about it. It's a little complicated. It's not something that strikes because we do it so comfortably that we never ever realize it. If you were building a computer that were to identify millions of faces and thousands of names and put them together, right? So, if generally for most people who are right-handed, the left side of your brain houses names. Okay, so the word, the letters, yeah, that's not simple. And the right side of the brain houses the picture of the face, the elements of the face. So for something that is really, really well known, like you can see spectacles and you know it's Mahatma Gandhi. You can see a beard and you know who it is. So like that. Okay. So if you look at it, um, name and face, opposite sides of the brain, completely different um, technology. If you think of nature as producing technology, and the brain instantly puts it together and picks out the pair, name face pair from somewhere in your hard disk where it had been stored, God knows when. There it comes. So as you get older and your hard drives get more and more stuffed up, that's okay. Yeah, if you don't think that the lady in front of you is your wife, then you have trouble.
The only thing is that, since you use the word, you use a reference of a hard drive, this hard drive, unfortunately, you can't do a control alt delete, right? You can't reset it. So
you can go to the Himalayas and go and put yourself in a cave.
Right. Okay. We have a few questions, and the number of questions that we've got, we could go on and on. So I'll quickly say them. One is from Harjeet Singh.
Suddenly the sun has come out.
So there's a question from Harjeet Singh. Do high BP and cardiac tablets taken over 10 years or more cause dementia?
What?
Do high BP and cardiac tablets taken over 10 years or more cause dementia?
No. High BP and cardiac problems cause dementia, not the tablets. Please get that clear.
We have a question from Ram Malkani who says, is tinnitus an early sign of dementia?
I'm not very sure. I will need to look it up, but I don't think so. Typically, of the senses, what we look for is loss of the sense of smell. That's an early marker of brain degeneration, loss of smell. So people have used that in testing. We know, for instance, Parkinson's often begins with early loss of smell, and COVID does too, unfortunately, but that's usually temporary. But we know that dementia or also probably smell that is affected. Tinnitus, I don't think so. I mean, I'm sure there may be some article somewhere which says that, but I don't think so.
We have a question from Draupadi Chablani. Says, my mother is 83 and she started imagining things.
Okay.
And she hasn't asked a question, but she's perhaps looking for some advice as to whether this is dementia and what can she do.
Could be. Could be. Because if somebody who was completely stable shows a behavior change, it means that something has deteriorated.
Right. The next question is from an anonymous attendee who says, I've been diagnosed with essential tremors. I'm on Prolet 25, 2 tablets twice a day. Now my jaw and voice box have also been affected. Is there a way to reverse or control them? Will it progress?
Essential tremor is generally, I mean, depending on how severe it is, it can be disabling, but it doesn't generally affect memory. In a small number of people, it kind of goes on to produce Parkinson's, and that your doctor should be watching out for and warning you about. But essential tremor is uncomfortable, sometimes disabling, meaning it actually makes problems for you in day-to-day life. But well, it obviously does not look nice, but no, it doesn't affect your life in any otherwise.
We have a question from Nana Bose. Says, my father recently discovered from severe lung infection due to COVID. Now he's back to normal routine, but he's becoming absent-minded recently. He is 68 years old, and yeah, basically that's a question.
Yeah, so there has been a certain amount of literature about people who had maybe early dementia or even less than that, and who seem to be have done much worse after they've been through a bad bout of COVID. And I would wait to see if it evolves or if it recovers, but at some stage it might be good to get a proper evaluation.
Doctor, this is a question that you've answered, so I would also urge people to
just take a minute to just pull my curtains. It's a little
sure.
right behind me, I think.
So as Dr.
No, go ahead. I mean, I can hear you. So the video is off, but I can.
So as Doctor gets back, I would urge people to go to the webinar section of Seniors Today, the website. That is seniorstoday.in/webinar, and look up the archives of the webinars. We've had Dr. Gursahani, who was here a few months back, and who spoke about palliative care for neurological concerns. And yeah, so that's basically what it is. Seniorstoday.in/webinar. That's the destination that you should visit to look up all our archives. I think we've had over 50 sessions so far. Doctor, we have a question from Jayashree Dikshit, who asks, today's time when children are abroad and servants not available, how to take care of a dementic spouse? It is so taxing for the other person. We cannot even leave him alone. Then what is the solution? The other spouse's life is so badly affected. Is there a way out of all of this?
Yeah, I understand that, and that is something that we keep grappling with. One thing is, I do think that in some ways, taking care of somebody with dementia is perhaps easier in India than anywhere else if you are going to do it yourself. This is because labor is still cheap. So, of course, because of the pandemic, things are not easy, but and of course, depending on your financial resources, uh, it it can cost a little, quite a bit. But having uh, caregivers, caretakers, paid caretakers, is possible for us. And to have caretakers who are trusted, reliable, it takes a certain amount of effort. But I've been through this, so I know that it can be done. And provided you invest in making that happen, it actually makes life much, much easier. Things actually become, if they start falling into place. So, anybody who's taking care of somebody with dementia, and if you can afford it, then you need to start investing. And this investment is not just money. You're going to have somebody in your house practically living with you. You need to be sure about how trustworthy they are. You need to relate to them. The patient needs to be comfortable. You need to know that the person you hired is going to care for your loved one as much as you would. All that. So it's not a easy thing to do. It takes a fair amount of effort, but once it is done and it works, it makes life much easier. So I strongly recommend working on having paid caretakers who you can trust.
And is there a resource bank where one can approach for, just as you have a nurses bureau, is there somebody whom we can approach?
No, unfortunately, I mean, this is an idea that we've been trying to float for some time, and that is that getting NSDC, I mean, National Skills Development, or somebody to make this a specific vocation where we can actually train people, give them certificates, make sure that they are, tested over time, and then so that a bank becomes available. But for that, these are things that, however much you may want to do it as an individual or even as a NGO, these are things that only government can do. So we've been asking, I mean, I haven't yet gotten through it, at least NSDC or somebody to get involved in this, because we have a huge need. So if you look at the ward boys or the orderly boys that come out, or the AYA that come, they are essentially untrained, and it's not that it takes very complicated training that you need to do. And on the flip side, given the issues of lack of employment and so on, that's something that would really make a lot of sense.
With the focus on healthcare as it is right now, do you expect that there would be enterprises, etc., which would come up offering all of these things? Because suddenly, people do realize that healthcare is important, and people need to look at these things. So, do you think the governments and do you think organizations, etc., would come forth to set these up?
Can I rant a bit for a minute?
Yes, please.
Yeah. Okay. So this is something that, this is a much broader question that I'm going to try and answer. But let me first answer the specific one that you said about agencies. And no, unfortunately, there are agencies. But you look at any of these agencies, I'm not going to name them. But this is the same thing that applies, whether it's software or anything. You train somebody, how do you know that they are going to stay with you after that? You put in the money to train them, they're gone. Right? So who can do this? Only government can do it. Only government can put the structures in place to make sure that the training is standardized. Right? Okay. So come back to healthcare in general. India spends a disastrously small amount on healthcare. Why? Because we as citizens have not bothered about it. When we fall ill individually. Mera naseeb. I did something wrong. You never put it together and say, no. There are so many things that the government could have done. I mean, now we know, for instance, that vaccines. It's a very straightforward, obvious thing that needed to have been done. So now we all understand that. Government needs to do that. That's not your and my business. Oxygen. Government needs to do it. That's not my and your business. Like hospital beds. So all of these things government needs to do, but citizens have never understood. And we in the middle class have very comfortably gotten away because we get fairly cheap healthcare as compared to international prices. We can all afford a healthcare. And it doesn't bother me that the person next to me is so badly affected by the lack of the same healthcare that I take it for granted. I know of a man who's effectively a billionaire living in a international city who was alone at home on a Sunday evening in his mansion. And he had a problem. He called up 911 or whatever it was. Those guys came, picked him up, took him to the local public hospital. He was checked out and he was dropped back home as the rest of the family came back. So you have to have healthcare that is so good that the billionaire will go there and the beggar will go there. It is only when you have healthcare of that standard and everybody gets it. We call that universal healthcare. That private healthcare will have to actually better it. Right now, I mean, mine is a great hospital, but I know enough private healthcare facilities who have just got to keep, 5 inches ahead of the neighboring Sarkari hospital and they get business. So private healthcare will not improve until government puts in money. And worldwide, the standard figure is something like about 10% of GDP. How much is ours? 1%. क्या मिलेगा उसमें? कुछ नहीं. So unless we tell government that this is what you need to spend on, we are not going to get it. And you will see that it's actually for India, it's been estimated that given our advantages of labor, of easy and cheap drugs, actually we can get a very good system for maybe about somewhere between 5 to 8% of GDP. But you have to vote people out for not giving you healthcare and vote them in for giving you decent healthcare. Remember that. Kerala gets good healthcare because people vote for it. Sorry, my rant is over.
Unfortunately, I don't think really we have any solutions. But, if all of us do raise our voice or do exert pressure, perhaps some of these things will happen. Doctor, I know we've far exceeded time we had requested you for, but broadly, as a sign off, is there some words of advice? A lot of people have asked us whether they should be exercising. Is there something that they should do to prevent dementia, which you of course responded to, but some overall words of advice as to what it is, and and we're going to come to you again once again because there are questions on Parkinson's and all of that, which we will come to you again later. But just as a sign off, would you give some words of advice to people?
So I'll tell you what I do. I monitor my own basic numbers, blood pressure, sugars. I don't have, fortunately, either of these, but I keep watching them. Cholesterol, I do have cholesterol. I take medication. I take medications for thyroid. So these are all the basic health checkup numbers that you need to target. Okay, keep your weight under control. I try and do that as well as I can. Exercise. There is nothing that works as well as exercise. And what do you mean by exercise? It doesn't mean going to the gym. It means brisk walking. And when I say brisk walking, And that, well, it will really depend on your age, how fast you walk. At the age of 40, you can probably jog. At the age of 70, you still walk briskly. You have to walk briskly enough so that you are not able to talk easily. So that you focus on the walking and not on the talking or whatever else it is that you do. And you do that for 30 minutes, at least once a day, preferably twice. That is the best preventive medicine for dementia that you can get. Far better than any doctor. So, exercise. Then there are a host of other things that are somewhat individual. For instance, sleep. Some people have obstructive sleep apnea. So, when somebody gets a lot of snoring and the snoring gets worse and worse, you have uh, poor oxygen intake, especially in the middle of the night, and you need to tackle that with an instrument. So you need that assessment. Then some people have very specific measures in the blood that need to be tackled, but those are all fairly specialized. In terms of understanding your own risk, in terms of your own genetics, yes, we are beginning to get more and more information, but this is all stuff that is in research. And I think if you watch out, if you look at websites, I'll see if I can share anything with seniors today. You could probably look those up. You need basically to take charge of your own health. And if you do that, well, you're fairly good.
Right. We have somebody saying exercise and sleep in dementia. Well, what doctor was suggesting was ways to prevent it. Doc, we have one question which I think, I will, it's important for me to ask you. This is from Jayashri Dixit. She asks, please tell us some good centers where the dementic spouse could be properly looked after. Nowadays, it's very difficult to find trustworthy servants.
No, I'm sorry. Unfortunately, I cannot answer that. So if you do, you can get involved with something called ARTSI, Alzheimer's and Related Disorders Society of India. That's an NGO that works with dementia. You can get involved with, I think seniors, you don't have any resources for this, but there are other people connected with old age who do help out with this. But unfortunately, we do not have facilities to take care of senior citizens with dementia, and it is entirely on families. And I come back to my rant. It needs money. It needs the government to put this in. Even today, if you spend a substantial amount of money taking care of somebody, do you get a tax rebate on that? You do partly, but much of it is not possible. So there are lots of things that the government needs to get involved in, provided they get out of doing other stuff that they don't need to. Health is something that we need to hold them to. And as we all get older, well, we need to make sure that the tax that we pay is paid back to us.
Right. Doctor, there's somebody who's asked that in a city like Mumbai, where we have 3 to 4 months of the rains, how does one exercise? How does one walk so briskly?
Unless if you're even in a small house, you can mark out an open space and you can walk. So it's brisk walking, that's all. It doesn't require huge amounts of space. If you're a little fitter and if you like the challenge, then stair climb. Go up and down stairs. That's pretty effective. If you want to exercise, you will find ways of doing it. Sorry, I don't buy that bit about rains and this and that, and I will start only later, and it doesn't work.
Absolutely. Thank you, Dr. Gursahani, for all the time. The number of questions that have come in, I've not been able to ask some of them, though we have answered most of the questions that have come in. thank you once again for spending the time, and always a pleasure to have you at the Health Live at Seniors Today Forum. Thank you to all our attendees for being here. It has been a pleasure having you. And we will be back once again with Health Live at Seniors Today next Saturday. Thank you, Dr. Gursahani. Thank you for your time.
You're welcome. It's a pleasure.